so that there are different criteria, and the committee has well-established approach to this. So it's not a purely subjective test. It's not just that the individual believes the remedies will be futile. One does have to point to some objective factors as well. Thank you.
Okay, thank you very much. Now, Holly Cairns.
Thank you, Chair. And just first of all, I suppose in discussing the importance and the necessity to ratify the optional protocol of the CRPD, I think we should note that this committee has heard several times from experts that the government could at any time ratify and has delayed the process unnecessarily. And the Assisted Decision-Making Amendment Bill 2022 was used as the excuse for this, and now the bill is taking considerably longer than planned. The Minister intended for it to be complete in July and commenced this month, with the acceleration actually preventing proper scrutiny of the bill. And the proposed commencement date is now January, but there's no guarantees of that. And disabled people and their advocates have been waiting years for both the ratification and the Assisted Decision-Making Act, and these delays are impinging on people's rights every day, and I think it's important that we note that. For the DSS, the Codes of Practice will be obviously an incredibly important document that shapes the lives of disabled people and others who require support in decision-making. Could you outline what direct engagements the DSS has had with disabled people's organisations or DPOs concerning the drafting and revising of the codes, and bearing in mind that witnesses to this committee have outlined how their involvement has been limited and resisted in some cases? Also, your website states that you're working towards having the Codes of Practice available in mid-June. So 5 months later, when are we expecting them to be published? And where is the delay? Is that with the DSS or with the Minister's office? The draft codes makes reference to the functional test of capacity, and Anya, you just touched on that, but this approach results in the substitute decision-making rather than supported decision-making, and the functional test of mental capacity has been found to be contrary to the Convention on the Rights of People with Disabilities. Subjective and biased in assessment, and General Comment 1 from the UN Committee on the Rights of People with Disabilities states that the functional approach attempts to assess mental capacity and deny legal capacity accordingly. Article 12 does not permit such discriminatory denial of legal capacity, but rather requires that support be provided in the exercise of legal capacity. So could you clarify that the functional test of mental capacity will be removed in the revised codes, given that it's contrary to the CRPD? And another question is just the National Advocacy Service, which comes under the Citizens Information Board, spoke at the committee a few weeks ago. They provide independent, professional and free advocacy services to adults with disabilities. I'm just wondering how the DSS will interact with them, and what do you see as the kind of role of those advocates going forward? And finally, I'm just wondering what steps is the DSS taking to meaningfully involve disabled people's organisations, especially those representing people most affected by the Assisted Decision-Making Act, in its preparations for commencement, and how it's ensuring that its process and outputs are accessible to everybody.
Okay. Will we go with Gerard first and then go to Anya afterwards?
Sorry, Mr. Chair. Were there some questions in there for me? I couldn't. They seemed domestically oriented. I wasn't quite sure.
They're for the DSS.
Yeah, we'll go to Anya.
Very good. Apologies.
So the first question's about the ratification.
Okay. Maybe Anya, you might take the questions that were directed.
Thanks.
Okay.
Thank you. I think if I take the codes of practice, first of all, we did have the opportunity to write to the committee chair. You would have a letter from us dated the 5th of July as this same question arose at a committee hearing of the 23rd of June, at which the Mental Health Commission was present. So I wrote to the committee thereafter. So specifically in relation to the consultation in relation to the draft codes of practice. Those codes of practice came to us having been drafted under the leadership of the National Disability Authority, and on the healthcare side by the multidisciplinary working group appointed by the Minister for Health. So both groups had engaged previously during that drafting process with relevant stakeholders and expert writing groups in the development of the draft codes. which then came to us. So we reviewed them in detail and amended the drafts prior to commencement of the public consultation process, which we conducted as required under the 2015 Act. Just to be clear about what the nature of a code of practice is, they aren't the only document that is going to exist to provide guidance and support for people who require access to the Act. So the particular status of a code of practice is that a person concerned shall have regard to a code of practice when performing a function under the Act in respect of which the code provides guidance. Under Section 103 of the Act, the consultation period is required to be of not less than 30 days in duration. 14 draft codes were published by the DSS for public consultation in 2 phases, which took place between November of last year and February of this year. And there are, 14 codes in total. The overall code relates to the supporting of decision-making and assessing capacity. And then there are sectoral codes for legal, financial, healthcare professionals, and codes for the specific decision supporters. We consulted then with the National Disability Authority, Citizens Information, HICWA, the AHD Multidisciplinary Working Group and representatives of professional bodies and of the healthcare, social care, legal and financial sector. In addition, we identified over 100 other relevant stakeholders and wrote to larger representative and network organisations asking that they would be communicated to their membership and more broadly so that all could be involved in the planned consultation process. We wrote to these organisations at the beginning, the middle and at the end of both consultation periods. The consultation process was also highlighted in our newsletters and in media. We ran a campaign that included newspaper advertisements, radio advertisements, social media and also publication on our DSS website. In addition, we made a series of presentations. We received over 300 responses to the codes of practice. It was a really meaningful and not at all narrow or constrained consultation process, and we were able to get really good feedback, which we've incorporated into the ultimate version of the codes. There are lessons to be learned, I don't doubt that for a moment. Currently, there was a question about timelines. The codes
Just before we move on from
the
that question, how many of the engagements were with DPOs was the question specifically? Was there engagement from disabled people's organisations?
Yes, we did hear back from disabled persons organisations, and we didn't get any response to say that there was an inability or a lack of opportunity to engage with us.
Which DPOs were engaged with?
As I Am provided a response. In the letter that I wrote on the 5th of July, in Appendix 1, I provided a full list of all who responded, and there were 300 responses in total. So we believe that we were able to take meaningful learning from that response process, and they're incorporated into the final version of the draft codes, which are agile documents, Deputy. They're not forever. We can revisit them. In addition to them, actually, we've also supplied a number of scenario or vignette type resources which will be accessible via the codes for the guidance of interested parties. And the codes may well require to be revisited, and I expect that they may be perhaps in early course as we learn whether they are fit for purpose. But we are satisfied that a consultation process was properly run, not at all narrow or superficial, and we're very happy with the outcome, but always willing to hear from stakeholders. You had a question actually about how we engage more broadly with our stakeholders. Again, in the letter to this committee dated the 5th of July, we provided in an appendix an account of all of the stakeholders that we've engaged with. I think this year I've met with up to last week about 101 different organisations. So we do see quite a bit of the people who are going to be impacted by this Act. Since last year, the Mental Health Commission has conducted a stakeholder initiative where we invite experts by experience to come to our board meetings, and disabled persons organisations have been represented at those meetings. Through the good offices of Inclusion Ireland, we've done focus group work where representatives of potential future users of our service have been able to look at our processes and our system to provide really useful feedback, particularly thinking about accessibility issues. And we have constituted a stakeholder forum, and the membership comprises in the Independent Living Movement, Mental Health Reform, Down Syndrome Ireland, Inclusion Ireland, As I Am, the National Platform for Self-Advocates, the Irish Deaf Foundation and the Neurological Alliance of Ireland. And this forum has been helping us provide expert consultative input on the public information campaign, which is to be launched shortly, our public digital portal, the development of policy, the provision of information in suitable formats, and overall the delivery of our service. But our door is open, and we are always willing to hear from people who stand to benefit from the Act and to take good learning from them as to how we can improve our accessibility and ensure an inclusive approach. You had other questions then. I'm sorry if am I taking up too much time?
Please, no, continue.
Yeah, in relation to the functional assessment of capacity, and again, we have addressed that in previous communications. The functional assessment of capacity, you had asked, is it to be amended in our codes? The functional assessment of capacity is the law, as I said, in relation to an earlier question, and is contained in the Act at Section 3 of the Act. So our codes need to be reflective of the legislation. We can't depart from it and remove it from the codes of practice.
Does it also have to be in line with the Convention on the Rights of People with Disabilities?
The functional assessment, and I know we've heard from our colleague in the IDA, is, it does attract quite a bit of comment, and General Comment 1 in relation to UNCRPD, which was published in 2014, I think, did say it made certain propositions that the functional assessment of capacity must be departed from, and also incidentally that substitute decision making is not permitted. General Comment 1 is not a legally binding document. It's a really important and influential document. It's divisive. I don't know whether our colleague would agree, and I think that most states party to the convention are not in strict compliance with General Comment 1. I'm open to correction, but I gather that perhaps only 3 are. The functional assessment is something which was very broadly debated in the run-up to enactment of the original Principal Act in 2015, and that incidentally is a piece of legislation which went through, I think, something like 14 different debates, and to good effect. It was the Act, I think, reflects improvements which flowed from those debates, so that originally this was a piece of legislation called the Mental Capacity Act and Mental Capacity and Guardianship Bill, whereas now it is an act which focuses on the importance of supporting decision-making, and will and preference is very much the golden thread that runs through the Act. If we were to take the functional assessment out, I think a few things would flow from that. You would effectively be dismantling a lot of what is core to the Act, and maybe that's something that is worth doing, but you can't do that and have urgent commencement. You are fundamentally rewriting the Act if you take it out. And the functional assessment is with us and has been at the common law since 2008. So it's an argument, and it's very forcefully argued in some quarters. In all of our stakeholder engagement, I don't encounter it. But if it were to be...
Yeah, we're a committee that's charged with the implementation of the UN Convention on the Rights of People with Disabilities, and we do hear from disabled people's organisations, and, you know, I sit on the Children's Committee as well as do other members of this committee that had that very rushed process of looking at the Assisted Decision Making Capacity Act. And one of the things that we heard from expert witnesses was that in using that test, the result of the test was different depending on who carried out the test, and that therefore it was kind of not a good test to use, and that oftentimes it discriminated against people with disabilities. So it's something that we need to challenge as a committee in terms of all of the legislation that we look at, and I certainly did in terms of when that legislation was being, what seems to be now unnecessarily rushed through, you know. And at the time the Minister was citing, you know, people in the UN and experts on committees, the Vice Chair of the UN Committee on this, saying that the Irish legislation was great. He actually came out afterwards and clarified that he's completely against the use of this test because it does discriminate disabled people. So I just wonder, in terms of, you talk about how it's dismantling then everything if, for example, the codes of practice didn't include it, but is it? Can we look at it with, like, does the DSS not also have to kind of try and comply with the UNCRPD as well as maybe Irish legislation that isn't up to scratch based on the fact that we didn't get to scrutinise it adequately, you know?
I think there's a few things